Hi, this is Dr. Wells with Wells Medicine. And a question we get very frequently is, can I bring someone with me to the infusion or to the stellate ganglion? For basically any of our procedures at Wells Medicine, we're happy for you to have a support person with you during the entire procedure. So some people will bring a support person and not want them there for our discussion at the beginning, but want them there for the procedure itself. That's okay too. And vice versa. Some people will want them for the discussion at the beginning, but not for the procedure. Whether it's that, they just want to focus internally on themselves during a ketamine infusion. I kind of think of it as like, if you were going to get a massage, would you want to have this person with you in the room for the massage? And a lot of people just want to go very internal, not feel kind of beholden to interacting with the other person they brought with them. Some people are just bringing drivers, a friend, a neighbor, someone that they don't feel comfortable having in the room with them, and that's okay too. Some people will want them there when things get a little intense, and then we encourage them to call us. We'll go get your support person and they can sit with you, hold your hand if you want to. Some people will want their support person with them up until the moment of the stellate ganglion, but maybe their support person doesn't really feel comfortable with needles or gets a little lightheaded with needles, and then they want to step out. Some support people will say, oh, no, I've got some work to do. I've got a phone call to take, and they want to go in and out of the room during the infusion, and that's okay as well. We ask that the support people in any procedure that they're with be very quiet, very respectful of the procedure for the patient's sake, that they respect that this is a journey. So trying not to ask, hey, what are you thinking? What are you seeing? What are you noticing? What's going on? But be very respectful that the patient may want to tell you, or they may want to sit there very quietly and just have you hold space for them. Some patients like to bring a therapist or a friend with a list of questions to help them kind of integrate the experience. Some patients may want their support person to be recording information that they say or that comes up for them, whether it's written or whether it's kind of a verbal memo or recording them. And some patients may think that that's the worst idea ever. We try to be very flexible and accommodate patients with whatever support person or support animal they bring. We've had support dogs come to the clinic, and sit with the patients during their infusions. We're happy to accommodate and to be flexible with whatever support a patient needs during their infusion or stellate ganglion block.